Hello, my name is Ify Etikerenche, IFY ETIKERENTSE, and today I'm doing the head to toe assessment for PNE 203. Before I get started, I'm just going to scan the room. Okay, so next I'm going to wipe my stethoscope, perform hand hygiene, put on my gloves. Go towards my patient and provide privacy. Hello, my name is Ify. I'm going to be your student nurse for today. I'm going to be performing a head to toe assessment on you. Is that okay?
Yes.
Great. So I have the patient's consent. Next, I am going to check his name. Can you confirm your name and date of birth for me, please?
My name is Amara and I was born on May 30th, 2010.
Okay. I'm going to confirm that. Okay, everything matches. So next I'm going to go ahead and do the general survey. Patient does look like stated age. His skin color is brown, which is normal for his generic background. His height is normal for his age. His body is symmetrical for his current position. The patient is sitting down. There are no obvious signs of deformities on the patient. His facial expression is normal and his mood is relaxed. The patient's speech is clear and he maintains eye contact. Do you mind walking back and forth for me, please? Okay, so patient's gait is his gait is smooth and he has full mobility of his range of motion. There are no distress signs or work of breathing. Can you tell me where you are today and today's date?
I'm at my house and today's date is Sunday, November 29th, 2020.
Okay, so his level of consciousness is alert and he's oriented ×3. Next, I am going to go on to the patient's head. I'm going to be inspecting and palpating. So the patient's head is circular in shape. There are no lesions, no scars. There's no swelling. Do you feel any pain?
No.
Okay, no pain. His hair is black. His hair color is black, which is normal for his generic background. His hair is thick as well, which is also normal for his genetic background. Next, I'm going on to the patient's face. The patient's face is symmetrical. There is no swelling. It is warm to touch. There are no scars, no lesions. Do you feel any pain or tenderness?
No.
Okay. Patient has no pain or tenderness in his face as well. So next, I'm going on to test for cranial nerve number 7. Can you smile for me? Frown. Show me your teeth. Puff your cheeks. Close your eyes. Open your eyes. Raise your eyebrows up. Okay, so everything is symmetrical. So patient has passed cranial nerve number 7. So I'm going on to the patient's eyes now. I'm going to be inspecting. So the patient's eyes are brown. He has even lash distribution. There is no discharge. His sclera is white and his conjunctiva is pink. Next, I'm going to be testing for cranial nerve number 3. I'm going to be measuring the patient's pupils. For length and symmetry, I'm going to be using my kind of like. Okay, so patient's pupils are about 4 millimeters in length and they are symmetrical. Next, I'm going to be checking for direct and consensual light reflex. I'm going to be using this. Is this okay if I flash this in your eyes?
Yeah.
Okay. Okay, so for direct, one pupil constricted, and for consensual, they both constricted. Next, I am going to be checking for accommodation. Can you just follow the tip of this? Okay, so both pupils constricted and there was convergence at the axis. So next I'm going on to the patient's ears. I am inspecting. His ears are symmetrical and there is no discharge. Next I'm going to be palpating the tragus and the auricle. Let me know if you feel any pain or tenderness, okay? Any pain or tenderness?
No.
Okay, so patient has no pain and no tenderness in his ears. Next, I'm going to be performing the whisper test. I'm going to whisper 3 words into each ear, and then you just repeat them after me, okay?
Black chair duck. Pillow, red glass.
Okay, so patient has no hearing loss. Next, I am moving on to the patient's nose. I'm going to be inspecting. So the patient's nose is midline, and there is no discharge. And next, I'm going to be palpating the frontal and the maxillary sinuses. There should be mild pressure but no pain. Any pain, tenderness?
No.
Okay, so no pain or tenderness. Next, I am moving on to the patient's mouth. His lips are pink and they are symmetrical. Can you see your gum? Gum. So patient's gum, there are no lesions or bleeding on the patient's gum. His teeth are normal and they are all present. Next, I am moving on to the patient's tongue. Can you open your mouth? Okay, the soft and hard palate rose. And they are pink. Sorry, the soft and hard palate are pink and they are intact. Can you stick out your tongue? Okay, his tongue is pink and there are no lesions on the patient's tongue. Next, I am moving on to cranial nerve number 9 and 10. Can you say R for me? Okay, so the uvula and the soft palate rose, so cranial nerve number 10 is intact. Next, I'm moving on to cranial nerve number 12. Can you stick your tongue out? Move it side to side. Say light, tight, dynamite.
Light, tight, dynamite.
Okay, so there are no tremors. The tongue is midline, so cranial nerve number 12 is intact. Next, I'm going to be moving on to the patient's neck. I am inspecting. There are no scars, there are no lesions. The color is consistent. I'm palpating now. It is warm to touch. There are no crepitus as well, and it is symmetrical. So next, I am going to be palpating the carotid artery one by one. Okay, so they are both symmetrical and the rhythm is regular and the grade is a 2+. So next I'm going to be testing for cranial nerve number 11. Can you rotate your head against my resistance? Okay. Shrug your shoulders against my resistance. Okay, so the resistance is strong, therefore cranial nerve number 11 is intact. Next I am moving on to the patient's upper extremities. Can you stretch out your hands, please? So the color is consistent. There are no lesions, no scars. There is no swelling. Do you feel any pain? No pain, no tenderness, and it is warm. To touch. So next, I am going to be moving on to the patient's nails. So his nail beds are pink and they are round in shape. Next, I'm going to be checking for the range of motion. So can you flex and extend your fingers? Flex and extend your wrist. And do the ulnar radial division. Can you flex and extend your elbows and do supination, pronation? Okay, so can you do external rotation and internal rotation? Okay, so there was no crepitus, there is no pain or any altered range of motion. Can you shrug your shoulders? Okay, and do abduction and adduction. Okay, so yeah, so there were no altered range of motion. Next, I'm going to be palpating the radial pulse. Can you? Okay, so the rate is about 65 beats per minute. It is normal. The reading is regular. The quality was strong, and the grade was a 2+. Next, I'm going to be testing for hand grip. I just need you to squeeze my hands very tight. Okay, great. Okay, so the grip was very strong and it is symmetrical bilaterally. Next, I'm moving on to the patient's lower extremities. I'm going to be inspecting. So the color is consistent. The color is consistent. There is even hair distribution. There are no scars, no lesions, and it is symmetrical. So next, I am going to be palpating. They are warm to touch. It is moist. Do you feel any pain?
No.
And there is no pain or no edema. Next, I am going to be palpating the dorsalis pedis. So it is strong, regular, and it is equal bilaterally, and the grade is a +1+. So next, I am going to be inspecting or palpating the posterior tibialis pulse. So I got about 65 beats per minute. The reading as well is regular. It is equal bilaterally with a 2+ grade. So next, we're going to do the dorsiflexion and plantar flexion. Okay, so can you do it yourself? Up, dorsiflexion and plantar down. Okay, so yeah. Okay, so everything is intact in the lower in the patient's lower extremities, and now I'm just going to perform hand hygiene. Next, I am going on to the patient's thorax and lungs. Can you please take your shirt off? Okay. Face this way. So I am starting with the patient's posterior thorax. I'm going to be inspecting. The color is consistent. There are no scars. There are no lesions. It is symmetrical. The anterior posterior transverse ratio is 1 to. Yeah, the anterior posterior transverse ratio is 1 to 2. Next, I'm going to be palpating. So it is warm. It is moist. Can you breathe in and out? In and out. Okay, and so there is chest expansion and there are no lesions. Next, I'm going to be auscultating for breath sounds. I'm going to be checking for wheezing or crackles. So when I put the stethoscope on your face on your back, breathe in and out, okay? Okay, so there was no wheezing and there were no crackles. Next, I'm going to be assessing the anterior thorax. I'm going to, can you face this way? I'm going to be counting the respiratory rate. Okay, I got about 16 breaths per minute, which is normal. The rhythm was regular. There were no distress signs or labored breathing. Next, I am going to be moving on to the patient's heart. So first we have the aortic area, which is on the right second intercostal space clavicular line. Next, we have the pulmonic area, which is on the left intercostal space clavicular line. Then we have the Erb's point, which is on the left third intercostal space. and we have the tricuspid area, which can be found in the fourth or fifth intercostal space on the left as well. Then we have the mitral area, which is on the left side on the fifth intercostal space, mid clavicular line. S1 sounds are best heard at the heart's apex, and S2 sounds are best heard at the base of the heart. So next, I'm going to start auscultating the patient's chest here. Then I'm just going to check the patient's apical pulse. Just stay still. Okay, so I got about 70 breaths per minute. The reading was regular, and there were no extra heart sounds. Next, I'm going to be moving on to the patient's abdomen. Can you lie down? Okay, so I'm going to start by inspecting for the symmetry. It is symmetrical. The umbilicus is midline. The color is consistent. There is no scar. There is no lesion, and there's no pain or edema. Next, I'm going to be auscultating the abdomen. Okay, so I hear gurgling and high-pitched bowel sounds. Now I'm going to be palpating lightly on all four quadrants as well. It's okay, just think. Okay, so I was palpating for tenderness and superficial masses, and there was no tenderness or superficial masses. Next, I'm going to be palpating the patient's bladder. Do you feel any pain or tenderness?
No.
You okay? Okay, so there was no pain, there was no discomfort, and there was no distension. So this brings the examination of this patient to an end. I'm just going to perform hand hygiene. You can get dressed and meet me outside.
Okay.
Thank you. Bye.